Hi, I'm Michael Santoro. I'm an occupational medicine physician. From a practical point of view, a lot of what I've been involved with over the years is helping people who have work-related conditions, whether they come from specific injuries or something that come gradually with time, such as carpal tunnel syndrome or other cumulative trauma disorders. I'm a big proponent of trying to keep people at work or trying to help people get back to work, because being active and having a productive life and being engaged in your life and in work is really probably one of the most healthy things that's available. There's something in research studies, epidemiological studies, called the healthy worker effect. And when we study large groups of people to kind of see what's their general health, who's living longer, who's having fewer visits to the doctor, actually the people that are working are the ones that actually are healthier, that tend to have longer life expectancies. It's not unusual for people to come to our practice to come from all over Washington and beyond. I've seen fishermen that have come down from Alaska, folks that are living in Idaho or Oregon, people from the Washington coast. I had a police officer from far away who would make a long trip to see me. We were able to enter him into a strength and conditioning program, and he was successful in returning to become a frontline police officer again. We have a group of highly skilled expert physicians that are really at the top of their game, and this is what makes my job a lot easier. That when one of the specialists that I'm working with tells me that a person's recovered from surgery or from a medical treatment point of view, they've had optimum care and they've completed what they can do, this helps me in planning for what that person is able to do in the future. Having indecision in life is probably one of the most anxiety-producing things. I'm impressed with the surgical skill of my colleagues, that when they fix something or kind of stabilize a wrist that's badly sprained or treat a fracture, I'm often impressed that the outcomes, how things turn out, are better than I would have expected. So being able to take someone with a very complicated history to figure out what has occurred and what are the missing steps or the things that need to be done to help them get to an optimal level of physical and mental functioning, and then helping all of these cases to resolve so that the person can then get their life back. I was an Air Force doctor for a few years in Fairbanks, Alaska and Tacoma, Washington, so that's how I learned about the Pacific Northwest. Ultimately, I became a physician for Ford Motor Company, and that's where I learned my specialty in occupational medicine, learned a lot about doing surveillance examinations, getting involved in workplace visits, walking around in steel mills and big manufacturing facilities. A company that's got a conscious effort to keep people engaged at work and to have them continue to work while they're recovering in something that's productive generally improves the outcomes. People make more complete recoveries, take less pain medicine, have less of a risk of developing long-term disability. I like the Pacific Northwest because of how beautiful a place it is, walking in the woods, taking wonderful beach walks, waiting for the sun to come out and seeing the mountains, breathing fresh air. These are all good things.